What is the difference between etiology and pathogenesis? Imagine trying to solve a mystery about how a disease starts and how it spreads inside the body. That's what understanding etiology and pathogenesis is all about. In medical school, especially in the first and second years, these are key ideas you need to get a grip on. They help you see the full picture of disease development. Etiology is like asking, what caused this problem? It's about finding the root cause of a disease. For example, if someone develops lung cancer, the etiology might include smoking, exposure to certain chemicals, or genetic factors. It's the reason why the disease began in the first place. Etiology can involve things like viruses, bacteria, environmental toxins, or inherited genetic mutations. Knowing the etiology helps doctors figure out how to prevent diseases or identify who might be at risk. Pathogenesis, on the other hand, is about what happens after the cause is there. It explains how the disease develops and progresses inside the body. Think of it as the story of how the disease unfolds step by step. For lung cancer, the pathogenesis would describe how the carcinogenic substances damage lung cells, how those cells grow uncontrollably, and how the tumor invades nearby tissues. It also covers the cellular changes, tissue damage, and organ dysfunction that happen as the disease gets worse. To put it simply, etiology is about the why of the disease, and pathogenesis is about the how it happens. Both are important in pathology, which is a big part of your medical school studies. They help you understand not just what a disease is, but how it develops over time. For example, with diabetes, the etiology could be genetic factors and lifestyle choices like diet and exercise. The pathogenesis would explain how these factors lead to insulin resistance, high blood sugar levels, and eventually the symptoms you see. Knowing both helps in diagnosing, preventing, and treating diseases effectively. In your second year, as you start connecting basic science with clinical practice, understanding these concepts becomes even more important. It's like building a map of disease processes that guides your future decisions as a doctor. So, remember, etiology is about the cause, and pathogenesis is about the process that follows. Both are essential pieces of the puzzle in understanding diseases fully.